Hello friends, I'm Dr. Artem Park. Massage one spot on your neck by yourself if you want to get rid of neck pain, headaches, or if you want to significantly improve blood flow to your brain. Because if you knead this point thoroughly and correctly, it opens up the blood vessels, the vertebral artery and the vertebral vein, which improves both the blood supply to the brain and the venous outflow. Thanks to this, ringing in the ears disappears, vision becomes clearer, the floaters in front of your eyes go away, and the feeling of fog, discomfort, and eye fatigue also fades. That's why, friends, I recommend that all my patients massage this point if they have any issues in the head area or the cervical spine. Friends, this point isn't some kind of magical or mystical spot. It's simply a feature of the anatomical structure's location. On its own, it can cause a huge number of symptoms and affects the intervertebral joints and discs, as well as the blood vessels. That's why when you work on it, the effect is very noticeable. I'd even say remarkable. So please, make it a habit to work on this area every day. Now I'll show you everything and explain it all to you. So the muscle we're going to work with today is called the inferior oblique muscle of the head. Please, take a look at the skeleton. The person is standing with their back to us. Here we see the occipital bone, and underneath it, deeper inside, is the first cervical vertebra, the atlas. This muscle actually starts from there, from the transverse process of the atlas. The transverse process is located right here. Friends, the muscle runs diagonally downward and attaches to the spinous process of the second cervical vertebra. Let me use this cap to show you more clearly. The muscle is about the size of this cap. It's located right here on one side, and of course on the other side as well. This muscle has a unique anatomical position. Why is that? First of all, when areas of local tension or trigger points form in it, it causes localized pain in the neck and occipital region, which can spread to the temple and the eye area. In addition, because this muscle is located between two neighboring vertebrae, when it shortens, it creates extra friction and additional sliding. This leads to accelerated degeneration of the intervertebral joints. Also, friends, this muscle, or more precisely under this muscle, there are blood vessels, the vertebral artery and the vertebral vein. So when this muscle is tense or shortened, it affects the blood vessels. Therefore, if these vessels are compressed, a huge number of symptoms can start to appear in patients. That is, things like floaters, a foggy feeling before your eyes, blurry vision, trouble concentrating, memory issues, weakness, fatigue, sluggishness, dizziness, and even ringing in the ears can appear. Friends, today we're going to work on this area together. So let's get right to the practice. We don't need a lot of theory here. First, with your fingers, you need to find the occipital protuberance on the back of your skull. Here, let me turn around. I found it on myself too. From the occipital protuberance, move your fingers downward and you'll feel a little dip. That's actually the projection of the atlas vertebra. So I find the dip, then from there we shift slightly to the side and I land on the projection of the inferior oblique muscle of the head. So in this area, we need to place the phalanges of our fingers like this and make rolling movements from the outside in. Friends, at the same time, you can tilt your head forward a little so that this muscle opens up. So I place the phalanges of my fingers on the projection of this muscle, slightly bend my head, and with pressure, deep pressure, I make rolling movements towards the center, that is, towards the spine itself. For 1 minute, we need to massage one side, then do exactly the same movements on the other side. We always work deeply, don't rush, and avoid any sudden movements. All movements should be smooth, right on the edge of pain, but still tolerable. In this way, we deeply knead this muscle on both sides, eliminate trigger points, and make the muscle softer and more uniform. While working on it, you may feel referred pain in your head, temple, or eyes. This is a predictable muscle reaction, especially if the muscle has been tense for a long period of time. Next exercise. Thanks to different ways of working on this point, on this muscle, we can target all the muscle fibers. We take a firm tennis ball, a massage ball, or you can even use a baseball. We place it exactly in the projection of this muscle. It fits perfectly here, both on one side and the other. So I tilt my head slightly to open up this area and hold the ball between my index finger and thumb so it doesn't fall out. Again, I place it on the projection of this muscle, press the ball against the wall, and with my other hand I press on my eyebrow to add resistance, then move left and right. This way, I knead the muscle along the muscle fibers. You can move down a bit to work the area, or move up a little to work it as well. Look for the most painful areas in this region and knead them. Just like before, 1 minute on one side and 1 minute on the other side. The third exercise. Now we need to work through this whole area to relieve overall muscle tension. For this, we lie on our back and place a massage roller under the projection of this muscle. With my other hand, just like in the previous exercise, I apply pressure to the eyebrow and make rolling movements in one direction. Friends, in this position, you'll be able to relax as much as possible. And by making the movements larger, going all the way to the middle, I straighten out, then turn as far as I can to the side. I return, turn, return, turn. In this position, we work on one side for 1 minute, and then we work on the other side for 1 minute as well. Next, after we've given this muscle and this area a good self-massage, we put away the massage roller and lie down on our back. Our goal is to stretch the muscle fibers and slightly increase the mobility of the cervical spine. To do this, we perform regular turns to one side and then to the other, to one side and then to the other. Friends, there's no need to rush. Smooth movements help increase the length and elasticity of the muscle fibers and boost blood flow through this area. Do these smooth turns for 1 minute. If you can't turn your head all the way, just stop at the point where you feel resistance. We never work through cane. At the farthest point, you may feel a slight stretch in the neck area. That's enough. In other words, we're not tearing the muscle. We're just gently stretching it to one side and then to the other. So, friends, we'll finish this set of exercises with a relaxing pose. Please take any towel and roll it up like this. The size of the roll should be such that when you place it under your neck, it feels as comfortable and convenient as possible. Actually, this is the most correct, most beneficial, and most natural position for our neck. Normally, the cervical spine has a natural forward curve called a C shape. So in this position, the neck muscles will be as relaxed as possible. The blood vessels are well positioned and nothing is compressing them. So in this position, you can close your eyes, set a timer for 5 or even 10 minutes, and just relax. Friends, keep your breathing steady and calm. And with every exhale, try to relax your muscles as much as possible. After you've rested like this, it's best not to get up abruptly. You can lie there for another minute or two, turn onto your side, and only then sit up. It's best to do this set of exercises in the evening before going to bed. If you can add a second session during the day, for example in the morning. That's if you have enough time. And friends, if you enjoy my videos, please subscribe to the channel. That's the best support you can give me. Thank you.